Earlier this year, we warned of a difficult financial situation, and this continues to be the case, with costs exceeding our allocated budget. In March, we reported that despite close monitoring and measures to manage financial pressures, we had incurred an overspend of 6.4 million in the year ending March 2015. This represents just over 2% of our £300 million annual budget. The previous year, we had recorded a small financial surplus. Unfortunately, we now have to report that further pressures in the current financial year, including repayment of last year's deficit, have resulted in a predicted deficit of 14.3 million for the year ending March 2016. In response, we have put in place a detailed financial review to save up to 17 million in the current financial year. Our principal area of overspend is our hospital services. For some considerable time, North Tyneside has been over-reliant on hospital services when compared to our neighbours in the North East. This means that providing care is more costly and we're not getting the best value for taxpayers' money. The solution to this situation is to make more use of existing community and primary care services, and where appropriate to develop these as an alternative to hospital-based services. This is particularly relevant for the 4% of our population on whom we spend 50% of the local budget. To address this challenge, we are working on a project called New Models of Care, which is designed to better meet the needs of this group, most of whom are frail and elderly. The project will provide a multidisciplinary team with the resources to meet the needs of this vulnerable group without always having to rely on hospital admission. I have many patients for whom going to A&E when they are unwell is not what they need, and they could be cared for more safely and recover more quickly in their own homes if the support was available. We will make sure that this group of patients are always able to speak to someone who knows about their care needs, no matter what day of the week or hour of the day. High-quality care planning and patient-centred services can promote their independence and reduce the need for hospital admissions. We also have initiatives that will improve care by ensuring that patients can access the most appropriate services rather than the more expensive, inappropriate services. We have other schemes which will reduce inefficiency and waste with no or minimal impact on patient care. However, we do have a duty to deliver healthcare services within our budget allocation, and if these schemes do not deliver sufficient savings, we will need to look at other areas of expenditure which may impact on the services currently available. There are tough choices ahead, but we are committed to providing high-quality healthcare in a sustainable way. The people of North Tyneside can help this situation by thinking carefully about using the right health services for their needs. This means treating common illnesses at home with advice from a local pharmacist, seeing your GP for most health needs, and only using accident and emergency for life-threatening and emergency situations. We have brought in an experienced director to develop and support us to deliver our recovery plan. We are working with our local hospitals, social services, the community and voluntary sector, carers and patients. If we can implement these programmes, it will reduce our overspend and we will recover our financial balance. This is at a time when the whole NHS is having to look carefully at each pound it spends. We are very fortunate to have excellent health and care services in North Tyneside, and levels of satisfaction with GP and hospital care are among the highest in the country. We want to maintain this quality, but we need to make sure that it is sustainable for the long term. If you have any questions or concerns about our financial plans, then please get in touch with us at the Clinical Commissioning Group.